Good afternoon and welcome to today's webinar, the second in a series created especially for community-based organizations. I'm Dr. Lisa Waddell, the Chief Medical Officer for the CDC Foundation, and I will be serving as your host today. The Foundation is extremely pleased that all of you have joined us today. We have more than 2,000 people registered and well over 1,000 already on today's call. This webinar will focus on COVID-19 vaccines to protect our communities. As the COVID-19 pandemic continues to skyrocket, health experts warn the winter months will be especially difficult. While the first safe and effective vaccine is now on its way to communities across this country, we know that individuals, you and communities will have questions about who will receive the vaccine and when. And we know that communities will also face numerous challenges related to logistics, distribution, and building vaccine confidence. An important part of our work is listening and learning about your needs, challenges, and successes as you support your communities. At our first webinar, you told us that one of your key challenges was how to address public health concerns in the communities that you serve. You also said that one of your successes during this pandemic is having community partners to help deliver messages. Your responses informed our agenda today. So first, in a conversation with CDC Foundation President and CEO, Dr. Judy Monroe, we'll hear from CDC's Principal Deputy Director, Dr. Ann Schuchat, about the COVID-19 response, including important information about the vaccine, distribution plans, and opportunities for all of us to work together to ensure that everyone that needs and wants this vaccine can receive it. Second, Dr. Monroe will lead a conversation with Dr. Virginia Kane, who is the director of the Marion County Health Department in Indiana, and Mr. Eric Moore from the Center for African American Health in Denver, Colorado, about important vaccine-related challenges and opportunities for public health and community-based organizations. We'll also conduct some live polling to learn about your vaccine-related challenges, and we'll close out today's webinar with a short Q&A and a call to action. So to keep us on track, we're going to keep our introductions short, and you will be able to see the full bios of our incredible speakers in the chat. Now, just a few housekeeping notes before we begin. All participants have been muted unless you're one of our presenters. Both the chat and the Q&A features are activated. So we ask that you please use the chat if you have a comment to make or reactions, or if you have a link that you want to drop in because it's something you think would be helpful to your colleagues. And then please use the Q&A function for any specific questions you have for the presenters. We'll do our best to kind of see what those themes are and to answer some of those during the Q&A period. We'll provide some instructions in a few minutes about our Zoom polling. And then finally, we want you to know that this webinar is being recorded, and you'll be able to view it online following the session along with the slides at our online CBO Resource Center. We invite you to visit our resource center at cdc.org/COVID-19-community-resources. So with that, it is now my esteemed pleasure to welcome Dr. Ann Schuchat, again, the CDC Principal Deputy Director, and Dr. Judy Monroe, who is the CDC Foundation President and CEO. Ann and Judy, the floor is all yours.
Thank you so much, Lisa.
Yeah, thank you. It's a pleasure to join you.
So, Dr. Schuchat, wonderful to have you with us, and I can't tell you how excited we are to have you be with us so that our participants today can hear directly from you about what's happening with this response. So Here we are, we're all in this together. We've been in this together for several months, as we all know, and now we have the hope of the vaccine, which is quite exciting. So I'd like to start, if you could just begin by giving us a brief update on where we are with the COVID-19 response, and particularly some information about the distribution of the vaccine.
Thanks, Judy, and welcome everybody to this webinar. It's been an incredible year and it's an incredible time, and it's really the best and worst of times right now, with cases, deaths, hospitalizations soaring in most of the country, but with the vaccines finally coming out to the field. So after a very, very intense several months of clinical trials and decision-making, the first vaccines made their way out to states and jurisdictions, really arriving for vaccination that began this week with the Pfizer vaccine. More than 600 shipments to jurisdictions around the nation, and being monitored all the way through, and the first vaccinations going in primarily to healthcare workers. Our Advisory Committee on Immunization Practices finalized recommendations for the early allocation of, or early prioritization of vaccine that had been authorized for emergency use by the FDA, the Pfizer vaccine. And that initial recommendations were for healthcare workers, or workers in healthcare facilities, as well as for nursing home or long-term care facility residents. The vaccination of healthcare workers is happening. Not just what you see on the media, but more and more each day. And we expect through the public-private partnership with pharmacies, that vaccination at long-term care facilities maybe starting likely on Monday, with some perhaps this week, but the larger scale clinics being set up starting next week. This weekend is a big one for the CDC, again, with the second vaccine, which is produced by Moderna. It is going to be reviewed by the FDA's Biologics Committee tomorrow. And if all goes well, it is likely that an authorization will follow from FDA. And over the weekend, our Advisory Committee on Immunization Practices will be making recommendations for that second product, which will give us a larger supply and more shipments. We believe that this month, the focus will be on healthcare workers and the focus on the long-term care facilities. And it will really be in the months ahead that we're able to expand the prioritization further. So far, so good in terms of the administrations, the systems that we've been building to help these the vaccinations begin appear to be working well. And the hotline that we've set up for clinical inquiries and for information and so forth seems to be happening. I want to also mention for partners that in addition to the vaccine distribution, which is really a critical focus right now, we've also been expanding other of the resources available to you. And our data tracker on the CDC's website now has a county view. So ideally, you'll be able to see the activity that's near you, what's really going on in terms of the COVID intensity in counties where you are. So that was a new function that has been enhanced in the past 10 days. But over 7,000 people at CDC are part of this response. We know that healthcare workers and community organizations are on the front line where the rubber meets the road, whether it's the disease and all of its implications for families and communities, or the vaccination and all that it takes to get vaccines safely and carefully into people with the monitoring that will follow.
So thank you for that. So maybe we can turn now to what's a concern for many of us, and that's vaccine confidence. And so we'd love to get your thinking, particularly about building trust and vaccine confidence, and how the community-based organizations, what role they can play, and how do you think about that?
Trust is so essential in any public health effort, and vaccination really calls on all of us to trust the system, to trust each other. It's not just trust in the product, but it's trust in every step, from the research to the production to the review process, all the way through shipment, delivery, and administration. We know that there's been a lot of concerns out there, whether it's from individuals and families or from communities, and that there's a lot of work to do. CDC has been working for some time on a vaccinate with confidence framework, which involves trying to reinforce trust, empower healthcare providers, and to engage communities and individuals. And the community-based organizations are central in this. You know, we've tried to reinforce trust by sharing openly and honestly the information about the vaccines, about the trials, about the decision-making, why healthcare workers and nursing homes first, and so forth, having open meetings that the public or professionals or partners can tune into. We've tried to empower healthcare providers. One way is by having them be the first among people to be vaccinated so they have firsthand experience, and by a lot of outreach toolkits, webinars. I think we had 80,000 providers on our calls over the weekend so that they would know what they needed to know to safely administer the vaccines. But where it really all comes down is how comfortable is an individual with that recommendation to get vaccinated. And that is really where trusted local messengers who know you, who've known you in peacetime and aren't just meeting you in the midst of this wartime or pandemic time, are critical. And so you as community-based organizations know the people you serve, you're part of those communities often, and you understand the issues. You can potentially be an ambassador or really start a dialogue and learn what are the concerns of your community and how can you make sure that we who are kind of leading this vaccination distribution and administration effort get the right answers to you. We don't want you to just sign on to everything we say. We want to answer your questions and let you, with confidence, serve the communities that you're in. But there's nothing like trust and familiarity to help people feel comfortable that they know how to protect themselves and their families. Every part of people's existence has been threatened with this pandemic. You know, people's lives and livelihoods, their loved ones, their holidays, school, you know, everything that you like to do, and even some of the things you hate to do, you have to do differently right now. And we need you to be part of this. You know, we know that there's a lot of work to do, that the vaccines are not going to reach everybody that wants them right away, and that in the meantime, continuing with the mitigation, continuing to wear our masks, continuing to avoid crowds and so forth will be critical.
Thanks. So thinking, you know, about looking back, and we know that hindsight is 2020. And so as we're coming to the end of 2020 and you reflect on the pandemic and the experience we have, what do you think are some of the lessons learned that might help our communities, and particularly our community-based organizations, as we address future disease outbreaks and continue with this pandemic?
You know, every emergency response that I've been part of, it seems like we have to learn the same thing over and over. You know, the first thing is listening. Second thing is humility. Third thing is partnership. You know, we need to understand what's important to people. We need to, you know, listen and learn and be humble about our assumptions. We need to communicate. And partnership is the way that you do that. You know, no one can represent the entire nation or the world. And this is a pandemic that's touching everyone. There's so much that we can do even before the vaccine gets to each of us or to our communities to reduce the spread and protect our loved ones and protect our hospitals, which are really at the breaking point in a lot of communities. But we have to be really working together. And I think for a threat like this that goes on so long and is almost unimaginable in the toll it's taken on just on human lives and on livelihoods, you know, figuring out those ways towards resilience and reinforcing each other's strengths. You know, Judy, you and I have been talking over the year, and, you know, we've had our good days and our bad days. And I'm sure every one of your organizations has been going through that, whether it's teleworking or, you know, adapting to the illness amongst your colleagues or your families. You know, it's been a really hard year. The vaccine, the first vaccine's here, the second one's coming, but we still have a long way to go, and we can't give up too soon. We can't really let our guards down over the holidays. We can't we really, we can see that the mitigation really makes a difference and that the vaccines are extraordinarily effective, that the safety profile so far looks good, but we're going to keep watching. We're going to keep looking. We're not going to say, just trust us. We're going to tell you what we see, and we want to listen to you as well. So I should stop talking and start listening.
Yeah, no, really great advice. And you're right. We continue to learn the lessons over again from one crisis, it seems. So given that we've got the vaccine and it's so effective, what's your prediction for when life will get back to normal, or will it ever be normal? Are we going to be living in a new normal following this?
I hate predictions, and I think they're usually wrong. And I also feel like each of us has our own inner psychology of, does it help me to have a goal date that, by X month day, everything's going to be fine? Or will it just be disappointing if it isn't? I think some of the things that we're doing differently, we're going to keep doing differently. There's some things that maybe we'll be more resilient and stronger for, but I know everybody's really keen to be able to gather safely with loved ones, to, get your kids back in school if they're not in school yet. We have a lot that we can do safely, but there's some things that are going to take a while. So, ideally, if the projections on the vaccine production and safety and performance are right, we should be able to get a lot of the broader vaccination going in the second quarter of next year. And the more people that are vaccinated, as well as the more we're wearing our masks and reducing transmission, the more we'll be able to be out and about. But, next summer, next fall, whatever I say, it's not going to be right. So I would just say that the next few months, we can really reduce transmission with the public health measures before the vaccine is widely used. And that will make that vaccine even more impactful once it gets out broadly. Certainly getting healthcare workers and people in nursing homes or long-term care facilities vaccinated will be a critical early step.
Yeah. So thanks so much. I think we're going to wrap up there and turn back to Lisa, but thank you for all that you're doing, Anne, and all the hard work at CDC. You all are our heroes. Thank you. I think it goes back to Lisa.
Thank you so much, Anne and Judy, for that great conversation, and for all of your insights, and for the amazing work that you continue to do on behalf of all of us. We certainly appreciate you all. So now it's time for our Zoom polling. So this is a very interactive part of our webinar this afternoon. And so I'm going to turn it over to Sharon Moffett, who's one of the CDC's senior advisors, to facilitate our listening session with all of you. So Sharon.
Great. Good afternoon, everyone, and so pleased to have you here. This is a very important part of our work with you today on this webinar. We want to really listen to what your ideas are, what your needs are, and to really understand together how we can best support the individuals in the communities. We want to hear from everyone as we do this webinar polling. All opinions matter. And this actually will be so important to inform our ongoing work to crush COVID and provide vaccinations throughout our communities. As we've said before, previous polls that we have used have actually helped inform our webinars, our community resource site, and also will continue to inform our ongoing work together with you to strengthen community-based organizations. So with that, we're going to move into an interactive polling. It's actually quite easy and quite fun. I'll go over each question, and then you'll be able to make your selections right here on the Zoom screen. Then we'll quickly share the collective results of that polling. And we'll note that your individual responses are confidential. What you're going to see is the aggregate of our responses. So let's take the first question here. And we really want to see who's in our audience. I see now we have almost 1,300 people participating on this call. So we want you to make one selection. What area does your organization represent? And that could be anything from public health at the national, state, or local level, community-based organizations, or maybe even more specifically, our faith-based organizations or academia. You'll also note there's a selection for other. And if you want to select other, then just put your response in more detail in our chat box. We'll be collecting that earlier or at the end of this discussion. So again, make your selection. Don't forget to hit submit. And in 5 seconds, we're going to close this polling and find our results. And again, we have a lot of responses here, but thank you. So significantly important that over 36% of those in our audience are from community-based organizations. Also a number from our faith-based and from public health, both at the national and state level. So again, thank you so much for being part of that. The next 2 questions are really critical to helping inform our work. So our next question, really we want to understand, what do you think community-based organizations need to support COVID vaccination efforts? We want you to pick your top 3. You'll see there's several choices here. Again, there's an other selection, so please check other and add. We really want to hear from you. And again, we're asking this question of all of our participants in the audience to help, in addition to the comments that we would get from community-based organizations, all of our partners can help us understand what those needs are. So consider the selections of stronger connections or culturally relevant communication materials, or perhaps helping community members address barriers to getting vaccinated. For example, transportation to the sites. So if you can make your selection, again, don't forget to hit submit. And in 5 seconds, we're going to close this poll. And as soon as we're ready, Malcolm will show us the results. And we're just trying to allow enough time to make sure everyone's had a chance to make their selection. Again, pick your top 3. There's lots of choices here. Fantastic. So again, what's really stands out, 64% of you said that one of the critical needs of community-based organizations is culturally relevant communication materials, both written and pictorial, that will focus on increasing vaccine confidence, similar to what we just heard in our discussion with Judy and Ann. So again, so many of these are related to communication. You'll see a broad selection. And I also want to note that over 40% of you actually indicated that partnership between local and community-based organizations. So now we're going to move on to our 3rd question. This is our last question in our polling section. What do you see as possible roles for community-based organizations in vaccination for COVID? Again, select your top 3. The other selection here, and then putting your comments in more detail in chat, will be also very helpful. We understand these are just a few of the many possible roles that community-based organizations can apply. So everything from linking with your local health departments to helping community members navigate to find healthcare and the clinics, or providing reliable information and culturally relevant information. So again, if you can pick your top 3, again, don't forget to hit submit. And in 5 seconds, we'll close out this poll. We want to make sure we capture everyone that's responding here and give you enough time to do that. And then Malcolm will pull up for us the results of this poll in just a few seconds. And So really quite a range of distribution here of your selections. What stands out is 74% of you said how important to provide reliable information and culturally relevant materials. And that's something I think we'll continue to hear in our discussions with our colleagues from CDC and with other speakers that will be presenting today. So with that, I want to thank you very much for your input, extremely informative, and turn this back now to Dr. Lisa Waddell. Thank you.
Thank you so much, Sharon, and thanks to all of you for participating in these important polls to inform our work with all of you. So now I want to turn our program back to Dr. Monroe, who will facilitate a conversation about our communities working together on COVID-19 vaccines. Our panelists are going to share some thoughts about vaccines and challenges on the ground, such as the issues, again, around vaccine confidence, the importance of collaboration, and how do we really work together on this tough and important challenge. So Judy, I'll turn it back over to you.
Great, thank you, Lisa, so much. And now it is my distinct pleasure to introduce today's panelists, Mr. Eric Moore, who serves as Policy and Research Manager for the Center for African American Health in Denver, Colorado, and Dr. Virginia Kane, Director of the Marion County Public Health Department in Indianapolis, Indiana. And she also serves as Associate Professor of Medicine at Indiana University School of Medicine. So welcome to you both. And what I'd like to do is actually begin with Eric. It's my understanding, Eric, that you are doing some really innovative work in Denver. So can you tell us more about the Center of African American Health and tell us more about your role in COVID-19 and vaccines?
Hello and good afternoon, everyone. Yes, my name is Eric Moore. So Center for African American Health, we are located in Northeast Denver, a nonprofit, and we're committed to improving the health and well-being of the African American community by offering community-based, evidence-based disease prevention and disease management programs, services, and events. To summarize our work, we have mainly 3 areas that we focus on. So we do focus on health programming that's community-based, very accessible. The second one is actually doing navigation services. We have a team that works with doing referrals to other partners, doing internal and external referrals, so working with partners in our networks. And then the third one is actually advocating in policy spaces for community priorities. I'll talk a little bit about our role. Could I get the next slide, please? So our role in the COVID-19 response this year really began in April. That's when we had the mobile, a lot of the ways in which that we interact and engage with community, mainly with direct resources. We worked with making sure that we got funding, and we were able to work with partners to get direct financial resources to families and individuals who were in need. And a lot of these are around direct emergency funding that was available to us from the state and foundations. With that, it was able to help with making sure that folks could pay their bills, be able to access healthcare. In particular, we had the opportunity to share $92,000 worth of these direct incentives to families. And we were also able to provide over 12,000 different PPE or personal protection equipment and other critical materials to families, to food banks, churches, homeless shelters, and other nonprofit organizations. With our partnerships, we partnered with the City and County of Denver, as well as local health, public health authorities such as Denver Public Health, to make sure that we served as a community site for a variety of different screenings, such as the COVID-19 test, and also working on making sure that we had free flu clinics available to community. So it was something that we made sure that we were able to do and continue to do to this point in the year. With our engagement, so we realized that we had to switch to having a better online presence. So with engagement and communication, that was really an opportunity for us to be able to make sure that we can talk to community members about some of the things that are going on with the vaccine, just with the pandemic response issue, and making sure we can get feedback from them as well as far as what their issues were. So in April, we had a virtual town hall that was centered around Black COVID issues back in April. And we also were making sure that since April, we've been having weekly Facebook Live lunch and learns in which we talk about COVID-19, but also we talk about a variety of different social and economic determinants that impact people's health and well-being. With the communication, with community engagement, something that we made sure when we worked with our partners in network that we were being responsible about the sharing of data, understanding the issues that were happening to our community across Colorado, and making sure that we had opportunities to learn from each other. In addition to that, we also had opportunity to make sure that when it came to survey research, that was something we were utilizing. We have a survey platform called Be Heard Mile High that allows us to, on a monthly basis, talk to 1,200 community members around these social and health justice issues. And it's a great way that we can make sure that we can get people into our referral system as well. If there are any assistance that's needed from them, we were able to use that as an opportunity to understand what it is that they're looking for and connect them to our navigation team. And then also throughout the year with program participants, we were always doing pulse checks with them to see what needs they have around COVID. Might be something they still is unaddressed, even if it wasn't within the program's objectives for them. And finally, mobilizing the board. So understanding that our board has a wealth of expertise and knowledge and connections that can make sure that they are accurately representing community issues. Aside from health, equity, and racial equity boards and committees, advisory boards and committees, we made sure that we're always from the state down to the community level, representing community. In particular, we are part of the Colorado Voice for Vaccine Equity Task Force, in which we were trying to specifically make sure that our community has a voice at the table in these policy spaces.
Thank you, Eric. That was a great overview of the important work that your organization is doing. And now I'd like to turn to my friend and colleague, Dr. Virginia Kane, to learn more about the community that she serves and how she's working with the community-based organizations in her role as the local public health director in Marion County, Indiana. But I know she was having a little technical difficulty. So Dr. Kane, are you with us? And if not, I'm going to go back. Dr. Kane, can you hear me?
May need to unmute Dr. Kane.
I understand she's with us, but I know there were a little bit of difficulties there earlier today. If not, Eric, I'm gonna come back to Eric. I think if Dr. Kane is having difficulties, Eric, come back to you and ask you more about if you could comment on the barriers that you're facing, as well as the opportunities to impact those that you serve. Could you share a little more about that, dive a little deeper?
Yes, absolutely. Thank you, Dr. Monroe. COVID has presented a lot of different difficulties for people who are doing community-based work. So some of the more obvious things were that we had to do remote work. We had to make sure that we can do more with online engagement. We had to actually make sure that we were assessing our partnerships and our networks and how we are best utilizing it during this time. And then also we had to look internally in our organization and say, what is the capacity for us to be able to deliver on community needs and really respond in an appropriate way. And that really regarded us figuring out where money flowed to help do with this response, where was staff time being committed, and then also what are the priorities of the organization now that the COVID pandemic was something that had impacted everybody here. Some particular barriers when it comes to community around this work has been obviously around trust and transparency. And that's really in two areas of just making sure that folks have the right and accurate information around the pandemic, the response from the state level down to community, around distribution plans for the vaccines, and then also the engagement piece. And that's actually making sure that we're actually bringing community into spaces in which we're listening to them and also actually having opportunities for them to share their story with policymakers, with community leaders, other CBOs, so that we can accurately get a picture while we are out there representing them out there in the policy space in particular. Second barrier we saw with that was just questions around access to the vaccine and also health-related resources. A lot of folks, with the COVID, there's always a concern about getting COVID ourselves, but a lot of community were actually worried about the fact that existing health disparities would just be more exacerbated. And there's a lot of data to support that we already had issues with dealing with inequities, and COVID just made it worse. So making sure that folks can understand the best practices around staying safe during this time, what the vaccine would look like. Now that it's the end of the year, we have more of an idea of that. And then also, of course, making sure people can still get access to healthcare services and other health-related resources as well, particularly when we think of social determinants of health. And then third barrier is something that I mentioned in the first part around trust and engagement is being representative of community in places of power. So being able to make sure that their voice is actually reaching the chambers, the state capitol, and also working with anybody else, other foundations that fund the work that community organizations do, and all the programming and events that community organizers are working on now. We realize that we want to make sure that folks, we can clear, as my executive director would say, Deidre Johnson, clear the haze around what's going on and making sure that folks have everything they need to be informed and make an educated decision around COVID-19 practices, but also around vaccine confidence as well.
Yeah, and thank you. And speaking of vaccine confidence, are there additional partnerships that you believe that you anticipate needing?
Yeah, we already work with a variety of different churches. I'm trying to think, when it comes to people who provide some more direct assistances like food banks, we've been making sure that PPE and other vital supplies, let them do their work, with something that we can help funnel to make sure that they can continue doing it uninterrupted while themselves and also to the communities they serve. So I would say, looking at food banks, looking at homeless shelters, faith-based organizations and church groups, also youth advocacy groups as well, I think are ones that we want to make sure we utilize. We don't really know what, this will all look like the next few months, next few years. So we want to make sure that we're setting up the next generation with the right mindset and tools and creating that collaborative spirit around we're all in this together, and that we need to be able to work across different community differences. So I would say youth groups are ones that I haven't really heard too much about, but I think that they're vital in making sure that they are feeling equipped and able to start these conversations with adults, particularly when you think about the kitchen table.
Yeah, thank you for that. So Eric, thanks so much. You've shared a lot of information with us, and we really appreciate the amazing work you're doing. Let me check in and see, did Dr. Keene, does she have audio now or able to join us? And if not, I'm going to turn back to Lisa Waddell.
Great. So thank you so much, Judy and Eric in particular for those remarks and sharing of all that information. So we have a number of questions that have come in. And so I think that we'll try to begin to get to some of those for all of you. And, I think one, just to start with you, Eric, is that, and Dr. Schuchat, you may have some thoughts around this too, as well as Dr. Monroe. But a question's come in about the role of local elected officials and how do we work with mayors and others, and what their role should be in bringing everyone together to ensure that the needs are getting met there in the community as it relates to vaccines.
Yeah, that's a great question. I think in particular, when it comes to local elected officials, they have, great power when it comes to working with organizations that advocate for some of these policy changes that help address health inequities. I think that their role is to make sure that they and their offices are concerned with making sure that community-based organizations, faith-based organizations, someone mentioned in the chat also looking at immigration-led organizations, immigrant-led organizations, that they're being conveners of that, that they're working to make sure that they can bring all of these different entities together to learn from each other, to strategize, to share work, share funding, other resources like workforce, to actually address these things. I think that they have a vested interest in making sure that this is as collaborative as possible, and it's to the greatest benefit of everybody in the state that you reside in. So I think that that's the main role, is making sure that they bring people into that space and that they're receptive to being part of that work. CBOs can find a lot of times where they're working with each other and it can be hard to connect with policymakers. So I would invite them to be open to that and working together alongside with us.
That's great. So I think this one probably is for Dr. Schuchat, but there are a number of questions that have come in regarding communication materials, and some questions such as how will local community-based organizations be engaged in vaccine communications? When and how do they reach out to their state, local, and/or federal partners? And then a number of questions regarding toolkits, or when would tools be ready and available and in multiple languages? So I wonder if you might be able to comment on that for us, Dr. Schuchat.
Sure, great questions. And, you know, we know that the demand or thirst for information and tools is enormous. And, you know, this is a 24/7 operation here that is trying to meet the demand, because the initial vaccine doses are going, you know, are just not enough for the whole country at all, but will start to make a dent in the healthcare worker and nursing home populations. The information needs for those two sectors have been the original, but we know that healthcare workers speak a whole lot of different languages, and they're, the community groups can be good translators. So multiple times a day, more information is being added to our website at cdc.gov, including the toolkits for healthcare settings, for nursing home, long-term care facility settings, multiple languages for some of the materials, and through partnerships, we're getting more languages. But I think it's important to say that while the vaccine is being allocated, the number of doses are being allocated out to jurisdictions by Operation Warp Speed, and CDC is working very closely with each of the jurisdictions, state or local public health, in terms of the planning for the vaccination. It's this is really where the vaccine is going within that state jurisdiction is being designated at that state level. So which hospital to vaccinate their healthcare workers is being determined at the state or jurisdictional level. And so for community groups, knowing your state or local health department, their points of contact, their website will be more helpful to you, I think, than the CDC national viewpoint. But we do think that the tools and materials that we've developed can be adapted for your constituencies. Through the course of this pandemic, we know that immigrant populations, community of color, all kinds of groups are affected in disproportionately, and that the messages coming from that community group perspective will be better. But some of the information, like, what do I need to know about the vaccine? You know, that right now it's just the Pfizer vaccine. There's information about that vaccine on our, you know, fact sheets and so forth available on our website. What about the other vaccine? Well, we're preparing to get that information up after the FDA takes their action. Issues about safety. What do we know so far? How are we tracking that? We have information about that on the website that's adaptable for the patient or family member. There's some information, really, I see something in the chat about the misinformation and how do we do that. That's,
you want to show my video too? Show my face?
yes,
please.
Okay.
Okay,
Okay, I'm good.
maybe I'll stop so that it sounds like Dr. Kane is able to talk now, but basically on our website, we're updating that information about the vaccine. What does it mean for side effects? What do we expect that are common ones? What about the more severe ones? How were the decisions made? Was something rushed? The answer is nothing was rushed. What happened was they started on manufacturing at the same time they were doing the clinical trials. And that's why this happened so much quicker than is usual, because they started on the manufacturing, not knowing whether some of these products would make it all the way through the finish line of clinical trials. We just put the money up front as a government for that. But the safety assessments were not rushed. The clinical trials were large, 30,000 people got the vaccine in each of the trials, as well as, people got placebo. So there were pretty large numbers. And the people monitored the trial round the clock to look for results, and didn't take as long to process all the data, but really did it carefully. So I think those types of questions that were in the Q&A, we do have good information on that, and we're adapting it for the next populations, the ones that will come as things get broader.
That's great. Thank you so much, Dr. Schuchat. And you're right. A number of the questions have been around those issues that you just touched on, and a lot of FAQs on the CDC website that can be really, really helpful. So I'm going to see now if, yes, we do. We have Dr. Kane with us. We're so delighted that you've been able to join us, Dr. Kane. We know that whether you're at the state level and certainly at the local level, everyone's incredibly busy with all of the important logistics that are happening right now with vaccines. So I'm going to turn it to Dr. Monroe and for you all to have an opportunity to chat.
Thank you.
Well,
Very
thanks.
honored to be here.
Yeah, so welcome, Dr. Kane. I think we can let you go ahead and give us an overview of what you're doing and start with the first slide.
So thank you, Judy, and it's always an honor to see the amazing Ann Suckett doing what she does and the rest of the CD staff. So I'm just incredible opportunity for me to get a chance to speak to them. So, the challenges and opportunities for COVID-19. I'm also part of the member of the National Medical Association, the oldest Black physician network COVID-19 task force. And some of the things that we do based on what some of the questions they were talking about was we want to see not only how many people participate in the trials, but how many people of color participate in these trials, because we have clinical conditions that are a little bit different than, say, sometimes our white counterparts. And so we want to make sure we're not having any drug interactions or unintended consequences related to that. So we look at this very carefully. If I can have the next slide. Our demographic, just a little bit about us. We have 1.8 million residents in our metropolitan statistical area. There's 970,000 residents in Marion County, and we have a health department of 800 employees, and our budget is $76 million. Next slide. Sorry, I think so one of our biggest challenges is we have about 30% of our population is African American, 63% white, 10% Hispanic, and about 4% Latino, Latinx population. And for our Native American Indians, it's about a 0.4%. Our biggest challenge, though, is the fact we have a high infectivity rate, very contagious. And we have significant populations in our communities that are asymptomatic. So they're not even aware that they're infected. So they feel healthy, they feel great. So it's very difficult to identify them based on their symptoms. And so it's so important to do these clinical practices. But our number one issue is our vaccine hesitancy of vulnerable populations based on our historic experiences, but also related to our current health disparities. In the equitable distribution of COVID-19 vaccines, we want to make sure that's happening in those current providers who are working in low-income areas or the vulnerable populations. So will we see an equitable distribution of COVID-19? And lastly, our communication. We have a significant number of people who can't read, even in their own culture, their own language. And so we have different languages. We have a Burmese population, they have 12 dialects, as well as the linguistic messaging. But Our lack of patient-centered services, particularly as it relates to accessibility and affordability, is critical in trying to address the information and messaging to our populations, and our shortages and scarcities of resources, not only for public health, but for a lot of our community health organizations, where we need personnel, financial support, equipment, supplies, and education. And lastly, it's the absence of fiscal and structural wherewithal for historic organizations that have been serving populations, that they need resources for organizational and operational infrastructure, communication and information underpinning, equipment or other consultative and other support, maybe partnerships with other organizations that have resources. My next slide, what are our unique opportunities? So the provision of direct and sufficient financial support for public health agencies and other longstanding organizations serving vulnerables, we can implement community-driven vaccine hesitancy campaigns to dispel a lot of the misinformation. We need to facilitate comprehensive community and patient outreach activities that focus on COVID-19 prevention, vaccination, and treatment. But we need to identify and recognize expanded use of the roles and use of neighborhood recognized communicators. So how do we appropriately leverage the clinical expertise and establish relationships of our longstanding community-based organizations to address COVID-19 and its other related issues? For example, really promoting influenza vaccination to help us with this epidemic, okay? But we need to ensure that financial resources and other capacity building health agencies or community-based organizations can be adept at providing health education for our providers and facilitate direct services to patients. So what am I saying? A lot of our community-based organizations are capable of providing education, and they can steer referrals or services, but they need some assistance for capacity building, but they can be tremendous in helping to facilitate a lot of our services, direct services to our patients. Lastly, we want to increase the full array of assets for public health and community-based organizations to overcome identified and unforeseen COVID-19 obstacles. Maybe they need trained nurses. Maybe they need legal services. We're having an issue here where our Latinos, when they say, hey, I am COVID-19 positive, and they're talking to their employers, within 24 hours, they are fired. And so how do we understand patient rights? And organizations, community-based organizations can help with that. But they can get contact tracing, help us assist that. Community health workers are important. We may need robust information technology and communication experts to assist us, even epidemiologists, and critical partnerships with academic resources. We have wonderful opportunities to really enhance education in our communities, but it's all about critical partners, people that have been long-standing trust in their neighborhoods because they've been there and they have helped to provide services and education. So with that, I'll stop, Judy.
So can I just say, I just have to tell everyone that I worked with Dr. Kane when I was the Indiana State Health Officer, and hearing you today, I really missed working with you. We had an opportunity to work during H1N1, so thank you for that. Very emphatic and really tremendous points that we all need to take action on, and mobilize resources is one of the things I heard in this as well. Let me, I know we're coming to time, so I'm going to turn back to Lisa Waddell. Dr. Waddell is our moderator. you want to go next?
Yeah, absolutely. So, wow, just so much important information there. And we are coming up to the top of the hour. But I'd like to at least give you one question, Dr. Kane. And so let's talk a little bit about, I think you've really reinforced the importance of funding and resources needed for community-based partners, for them to really have that infrastructure to be that engaged and trusted partner that we know that is so critical. Can you say a little bit about sort of the notion of sort of shared learning across organizations? Because I've seen a couple of comments and questions about the importance of peer-to-peer learning. Do you want to say a word about that?
I think that's really critical. We have historically have worked with a number of our community-based organizations, and as a health department, I think this is a model to look at. We use over $1 million of our property tax dollars to help provide financial direct resources to community-based organizations to help us with our health outcome. So we can provide our faith-based individuals with education for peer educators in the faith base. We have like Minority Health Coalitions, we have the Urban League, but we provide the resources and tools for them to help promote and do that outreach. And I just think that's so critical. And we're learning a little bit as we go. So who's educating our providers on the vaccines and the side effects? Who's doing that education for our community-based organizations, who in turn have a significant number of clients that they serve and been there in their communities forever, and are known as trusted advisors. So that's the best model. And we need to strategically figure out a way how to get that funding down to community-based organizations.
Thank you, Dr. Kane. And so this theme around the importance of partnerships and collaboration is critically important. And I think the other theme that has clearly come across is the notion of communication tools and resources. So people are hungry for it and want to ensure that the best information, the correct information is available and being shared, and people receive information in so many different ways. So thank you so much. Judy, I'm going to turn it back to you to wrap us up and give us our call to action.
So thank you, Lisa. Thanks again, Dr. Kane. Great to see you, Jenny. So now is the time. I mean, you heard the passion, and you heard really, I think Dr. Kane just gave us a call to action. So we're in these early stages of having a vaccine to prevent this deadly COVID-19 disease, and that's now a reality. But now is the time that we really do need to come together and continue to listen. We heard that throughout the webinar today, and provide timely and factual information in culturally appropriate ways so that our communities can gain knowledge needed around this important new vaccine. Second, let's mobilize our communities at that grassroots level to get the vaccine when it becomes available to them. And third, let's continue to act decisively with the tools and on the tools that we do have in our toolbox right now. So just to recap a little bit what we've heard today, our collective really call to action, and you heard this from Dr. Schuchat. Practice the 4 W's. Don't let up your guard, and make sure you're using all your spheres of influence. Wear a mask, watch your distance, wash your hands, be wary of crowds. Holidays are coming. Think about even with the small gatherings, and take your flu shot and encourage others, because we cannot let our guard down. We're going to be needing to do these mitigation behaviors for a long time yet. Secondly, connect and collaborate. We heard that loud and clear from our speakers. Remember that one size doesn't fit all. When all communities are quite different, and our community-based organizations are the trusted partners in helping to reach the unique populations in our community. So partner, collaborate, and customize when needed the methods by which the key messages are delivered. And third, communicate effectively to strengthen the vaccine confidence. This is really important. Vaccines don't save lives, it's vaccinations. We got to get it in the arms of folks. And so embrace the different communication channels and trusted community messengers to learn as much as we can about the COVID-19 vaccine, using multiple forms of communication. And finally, we encourage you to go to the CDC Foundation Resources for Community-Based Organizations webpage and use the materials there. And I do want to give a shout out and a big thank you to all of you who participated today. I was following the chat, and there was some really rich information in the chat and questions that we were not able to address. We will be looking at all of those materials and applying that to the work that we're able to do on your behalf and on behalf of our nation. So together our impact is greater, and together we can defeat this pandemic and take on all of the challenges that our society and world face. So thank you for all that you're doing, and a real honor to work with you. Lisa, back to you. Lisa, you might be muted.
Thank you, Judy. And as we close, we all know that vaccines work. This is a historic time in our country, in fact, our world. Far too many have suffered and died from this virus. We all know this, the virus, it's our enemy. The vaccine is a prevention solution. So working together, we can all and we must work together to end the suffering and the loss that's happening from the COVID-19 pandemic. We hope this webinar has been informative and helpful to you today. We invite you to utilize the resources on the resource page that was posted in the chat. We hope that you will continue to join us for future webinars, so look forward to future invitations. Again, thank you to all of our speakers, our panelists, and for all of you for your active participation, as Judy indicated, such rich conversation happening in the chat. So the slides will be available, a recording of this will be available, all on our resource page after today. And you will, as you close out, tell us how we did. There'll be a couple of brief questions as you leave today's webinar. We thank you again for your time and participation. And this concludes our COVID-19 vaccine webinar for community-based organizations. Thank you.